Rates of cancer cases and deaths are projected to decline in Canada this year, largely thanks to prevention and early detection programs. That's according to a new study in the Canadian Medical Association journal released today. But researchers say there's still much more to be done to save and prolong lives. Emily Taylor joins us live from outside of Juravinski Cancer Centre in Hamilton with the details. Hey, Emily.
Hi, Matt. Now, according to that new study, around 247,000 Canadians will be diagnosed with cancer this year, and around 88,000 will die of the disease. Now, both of those rates are on the decline. That's largely thanks to those early preventions and interventions that you mentioned. That's something a cancer survivor I spoke with earlier today says are vital.
I had breast cancer, had breast cancer, and I am now a graduate of the JCC breast cancer program. I am a thriver.
Nancy McMillan is a survivor after her battle with breast cancer 17 years ago. It's that diagnosis that pushed her to start the Bright Run in Hamilton, raising money for Juravinski Cancer Centre, where she was treated. That includes helping to fund the PINK program that promotes early detection of breast cancer in younger people. According to Juravinski's website, around 10% of their breast cancer patients are under the age of 40.
There's nothing more important than taking care of yourself, and part of that is a regular screening regime, not only here at the Breast Assessment Centre, but also your self-exams.
Later this year, the age for breast cancer screening in Ontario will lower from 50 to 40. A new study published today in the Canadian Medical Association journal suggests the rate of cancer cases and deaths in the country will decline in 2024, largely due to a push for prevention and enhanced screening programs.
Because we know certainly that the sooner that we catch breast cancer, the better the outcomes. You know, the better, the less invasive of the treatment. So if we can catch it sooner, we can screen earlier, you know, those outcomes are really starting to show now.
The CMAJ study suggests the rate of breast cancer diagnosis will remain stable in 2024, and mortality rates are expected to decrease. Other types of cancer, namely lung, colorectal, and prostate, are projected to decrease this year, but less common cancers, including melanoma, liver, and kidney cancers, are on the rise.
For lung cancer, we've seen a big drop in the mortality rates, and this is because of the really great tobacco control policies that have been implemented and all the smoking cessation programs.
While the rate of cancer diagnosis and deaths are down, the overall number of both are estimated to rise, with 247,000 new cancer cases and 88,000 cancer deaths expected.
And this increase is what we would expect because we have an aging and growing population.
The study also highlights the need for more research into cancers that don't have routine screening methods.
I do not want my 3 granddaughters or my grandson to have to walk in my shoes, so anything we can do to support education, self-knowledge, and self-care, let's do it, because we don't want that number to rise.
Organizations I spoke with today say it's, of course, very important to do those early screenings to catch cancer, but they also highlighted the importance of funding more cancer research to look into the risk factors and causes to prevent more cases to begin with. We'll go back inside to you, Matt.